Channel 3 Eyewitness News reporter Mike Savino is live in Glastonbury tonight with why it's not just the increase in patients that has doctors worried. Mike.
Yes, that's right, Aaron. Of course, they are worried about those hospitalizations going up, but this is also coming at a time when hospitals around the country are facing staffing shortages, which of course means fewer nurses and doctors than we've seen during previous surges. In fact, an executive with Griffin Hospital said today that statewide about 80% of staff beds are now full, and that is why public health officials are trying to make a push to get people vaccinated. Now, that number is not just vaccinated COVID patients. It's also non-COVID patients, but it's the COVID patients that doctors are trying to address. That's why they're pushing vaccines. And of course, today, now 16 and 17-year-olds can get the booster shots. Now, I was at a pop-up clinic in East Hartford today with Public Health Commissioner Manisha Jutani swung by and said she wants to see more of these around the state. Booster demand is high, but it's the unvaccinated that remains a concern. So public health officials hope that these pop-up clinics will make it more convenient, and that will get more people to come out, along with outreach and education.
If you have a mild case and you don't end up in the hospital, that is a win for this vaccine, and that's a win for you and your family.
Bring it into the communities makes it much easier, especially for the elderly and the handicapped people trying to get access.
Now, doctors continue to call this a pandemic of the unvaccinated, and in fact, that gap might be growing. Doctors say that now roughly 80% of patients in the hospital with COVID are unvaccinated, and even of that 20% or so that are vaccinated, some of them are going in for other procedures, but then testing positive when they go in, so they're not even going in for COVID symptoms. Live from Glastonbury, Mike Savino, Channel 3 Eyewitness News.
All right, Mike, thank you very much. And we want